All right, so we'll get started. Today we have Dr. Denise Hanscom here. She's a naturopathic doctor. She's a wife and mom of three and co-founder of Abaton Integrative Medicine Center in Oakville. So I am happy to be here speaking with Dr. Denise. I'm Danielle O'Connor, also a naturopathic doctor. And today we're going to be talking about some of those early pregnancy tips. So a little bit about Denise. Dr. Denise became a naturopathic doctor to educate her patients on how they can optimize their health and the health of their families. So her passion lies in supporting the health of future generations. And because of this, she has completed additional training in prenatal and pediatric care, environmental medicine, hormonal, and digestive health. So it's so nice to have you here today, Denise. Thank you for being here. And we're going to, I know your topic here, we're going to talk about some tips from a naturopathic doctor really on how to support you during those first few weeks of pregnancy. So let's get started. I don't know if you want to do a little intro yourself there.
Yeah, well, thank you for that introduction, Danielle, Dr. Danielle. So I am a naturopathic doctor in Oakville, and I do have a special focus in prenatal care. And I'm really passionate about pregnancy and postpartum care, and specifically filling in some of those educational gaps for patients where they may feel a little bit lost along their pregnancy journey, where that care may not be as supportive as they were thinking it would be before they became pregnant. And one of those times is definitely the first few weeks of pregnancy. It's kind of a whirlwind. You know, it's like exciting and you're not sure what's going on, not sure what you should be doing. And often there isn't a lot of support at the first few weeks. So we like to kind of fill in those gaps and get women started on supportive support even before they see their OB or midwife.
That's amazing. So yeah, because it usually takes a couple months before you're really getting that initial appointment.
Yes.
So yeah, take me through, the process there. So, you're super excited. You just received a positive test on that, like at-home pregnancy
Yeah.
test. So really, what do you usually suggest as your next step to your patients?
So usually I'll recommend that they get some blood work done. So sometimes they'll be coming to me or like they, let me know they're pregnant just from the at-home pregnancy test, or sometimes they've already come to me with blood work from their medical doctor confirming the pregnancy. But usually we like to confirm the pregnancy with blood work, and that's usually taking a look at a hormone called HCG. So once that's done, if they haven't had blood work previously done and they've seen me before they go get that blood work done, I will maybe add a couple other additional blood tests that I like to test for that first trimester of pregnancy. But first, we just definitely want to confirm the pregnancy through blood work and getting that HCG value tested. And then other things that we like to look at too, and again, it depends on the case and the person, but progesterone is another one that I do like to mention for patients as well, depending on the patient's history, health history, if there's any histories of miscarriage or they're having any type of symptoms such as cramping or spotting, or the HCG is not increasing at the level we want it to, I will also recommend them taking a look and getting some progesterone done as well. And then from there, once we confirm pregnancy, then we can start that prenatal support. So definitely making sure they're on the right prenatal vitamin for them, as well as any other additional supplementation they may need, depending on their health history and also just from a nutritional perspective for themselves during that first stage of pregnancy.
Okay, so that's great, and it does sound very much specific to the individual, because not everybody is going to need progesterone, so you definitely do have to look at that history. As your patient comes in, there's going to be a bit of a specific plan for each person, right? So now, just curious about, you mentioned the prenatal vitamins. So how does somebody go about choosing the right prenatal for them? Because there's so many out there, right? Like there's so many that you see advertised, whether it's on TV or, in drugstores or health food stores. But yeah, how does somebody really find something that's specific for them?
Yeah, so you're right. There's lots on the market, but there's three things I like to three tips that I like to mention when choosing a prenatal vitamin. First one being the dose of the vitamins and minerals that are in the supplement. So again, having your naturopathic doctor help you identify the doses that you need is important, but getting one that has a good dose of each of those vitamins and minerals for optimal effects. So example I like to say is B12, making sure that it has 1,000 micrograms of B12 in that support based on the recommended dose of that supplement. Then we look at the form of the vitamins and minerals in the supplement. So making sure that they're in their more active form, so they're better utilized by the body. Again, that's very individualized. We're not sure, not everyone can break down certain minerals and vitamins into their optimal form, so they're best used by the body. So we want to ensure that we're taking a supplement that has that active form already. One of the good examples of that I always like to mention is folic acid, making sure it's in that 5-methyl tetrahydrofolate form. It's a long word, but making sure that that's on the bottle, just because again, you may not be breaking it down in the appropriate way to be used by the body. And the last thing is what other extra ingredients and preservatives and dyes may be in that. So there's a lot of prenatal vitamins out there that do have extra things, like extra ingredients in them. Some of them you may not be able to pronounce. I know even like red dye number 27 or shalactase or all these other ingredients that may not necessarily be necessary to be in the prenatal vitamin are there. So I always looking for prenatal that has like no preservatives, no dyes, like even no soy, dairy, eggs, nuts, things like that, or gluten, things like that.
So it's interesting. You have to look at not only what's in it, but like what's not in it, right? So both sides of that, and just making sure that it's really clean. So
yeah, for sure. Yeah, absolutely.
Now, one of the big complaints, obviously, early on in pregnancy is nausea. And we know that, taking prenatal vitamins can sometimes make you feel nauseous. So, do you have any thoughts around that? Things that people can do?
Yeah, absolutely. So yeah, that's one of the biggest things I hear is that the prenatal, even if before they became pregnant, it was no issue. And then after, obviously, as things are shifting, they're like, oh, I take this and I don't feel well. So there's a couple of things you can do. The first tip I like to say is to keep your prenatal in a separate container and even in the fridge. So it just reduces that big whiff of supplement smell you may get when you open the bottle. So being in the fridge and then on its own in a little container can be helpful. Always taking the prenatal with food. And usually a larger meal. So even if they're taking it with food and they're saying it's still not helping, I'll just make sure it's with one of their larger meals. And then, because also some of the nutrients in there can be a bit irritating to the stomach on top of the nausea they're already experiencing. And then another tip is that we can actually combine, so another mineral such as magnesium, for example, can also be used to help support absorption of some of those irritating mineral vitamins in this prenatal vitamin. So taking an extra magnesium with your prenatal may help to reduce that nausea you're feeling.
Okay, great. That's some great tips. And now maybe you can explain some of those. If it's your first pregnancy, not even first pregnancy, but just, pregnancy can be very confusing. Your body is going through a lot of different changes, and especially in those first few weeks, can you kind of help people understand what the body is going through? What are some of the symptoms that they may experience in those first couple of weeks, in case, they haven't been to their doctor to talk about some of this?
Yes, absolutely. So there's lots of changes occurring in the first few weeks of pregnancy. So there's definitely symptoms you're going to experience. So we talked about HCG, that pregnancy hormone. So that hormone is going to increase about 8 to 11 days after conception and continue to increase during that first trimester. And as it's increasing, you may notice you can feel nausea, you can vomit from the nausea, you may feel breast tenderness, you may feel more fatigue. That hormone, HCG, is also the one that you'll read that comes up high when you do an at-home pregnancy test, but that's also the one we'll test on blood. And that hormone there, you want that to be rising during the first trimester because it's helping support progesterone production and also stopping the menses from occurring that month, from occurring once you become pregnant. And then the next one is progesterone. Progesterone is another one that will then also be rising to help support the uterine lining, to help with implantation, and also maintaining the pregnancy during the first weeks of pregnancy before the placenta takes over. So that's another hormone that will be continuing to rise. And then people might also notice symptoms with that increasing. Again, they may notice their mood is shifting, their breast tenderness may also be there as well. They must notice changes in their appetite and how they're just generally how they're feeling. So those two hormones are definitely at play in those first few weeks. But if other symptoms that you want to be mindful of too, if they're occurring, if you're feeling any like cramping is normal, but if there's any more intense cramping or there's any spotting or bleeding, or anything that just doesn't feel right, that's when you want to go seek some medical attention for those type of symptoms. But light cramping and some nausea and vomiting are all very normal symptoms.
Wonderful. Okay, it's great information just to really prepare people for what they may experience, right? Because sometimes things are happening in your body and you don't know what's going on. So it's great to kind of have that information there. So in terms of like yourself as a naturopathic doctor, what does a prenatal care plan look like for your patients? And what really should they be expecting in this pregnancy journey with you?
Yeah, so good question. So we like to support women all through all stages of pregnancy. Again, starting even before conception if they've come to see us. So we basically support them through all the different milestones of the pregnancy, and also supporting them through symptoms they may experience during those times. So changing their supplementation if needed. We will be changing the supplementation as they go through pregnancy, depending on the stage of pregnancy. So adding in an iron at a certain stage if they become like iron deficient, which is typical, adding in calcium magnesium support at certain stages. So at various stages of the pregnancy, we're there to help support symptoms through various routes, as well as to just ensure optimal wellness for both mom and baby as baby's growing. And then toward the end of the pregnancy, we help support preparation for birth. And then that's when acupuncture can come into play as well to help support preparation for delivery. And then that postpartum period is really important. We don't have enough support in that time. So basically, as soon as the mom is feeling well enough to come in to see us or even do a virtual call, we like to see them as soon as possible. Like I've had patients come in even a week after giving birth just to kind of get on track, make sure they're supporting themselves, make sure they're getting that needed support during those first few weeks when, again, things are kind of shifting and changing, not only for mom, but also because they have a new baby at home.
Wonderful. That's fantastic. Great information. Now, another question, can people have a midwife and an OB-GYN and a naturopath? Like how can that all work? Because I know there's a little bit of confusion about the other
Absolutely. There is lots of confusion about that. I get that question a lot. So basically, in Ontario, we're able to have for birthing, a birthing physician, we're able to have a medical doctor. So you can have your family doctor, an OB-GYN, or a midwife as the primary care provider. So you have to choose one of those professions for actually delivering your baby. But there's lots of additional support that can be implemented in conjunction with that primary care practitioner. So you can have a doula, which also accompanies that primary care provider during the birth and helps support the mom and the partner during the actual birthing process, and also leading up to the birth and then after. And then naturopathic doctors are great support alongside during the whole pregnancy. So it's almost like same thing as booking an appointment with your midwife or your OB-GYN. You book an appointment with your naturopathic doctor, and then we can kind of go over things that are happening for you during that time in your pregnancy. So we can be a great support alongside that primary care practitioner that will be there during the actual birth.
Amazing. Wow, this is great. Thank you so much, Dr. Denise. It's been great. You've answered tons of questions. I think that this will really help prepare people for that pregnancy, in the early stages of their pregnancy. So this has been wonderful information. Thank you so much for joining us here at Health Buddha. We will make sure to have all of your contact information. So if anybody would like to reach out to you to book an appointment, everything will be there for you. So this is wonderful. Thank you so much.
Thank you so much for having me.
Okay, take care.
Bye.